So we're about to actually start talking about the different types of valvular stenosis. So on that note, I just said let me just make a video trying to introduce the whole concept of valvular stenosis. So for valvular stenosis, what we have is valvular is like a heart valve. So stenosis just simply means the valve is no longer flexible, okay, to open smoothly, allow blood flow one way, then close to prevent blood flowing backwards. Do you understand? So in valvular stenosis, the valve is stiff, okay, and it has like a permanent opening. So of course this opening is not sufficient for enough blood to pass through. Then when those blood pass, there's still an opening that some of it will have to leak back. Those are all the complications that come up in valvular stenosis. So you have different valves in the heart, and this could actually occur in different valves. When it occurs in the aortic valve, that's when we say aortic stenosis. Alright. If it occurs in pulmonary valve, we say pulmonary stenosis. Mitral valve for mitral stenosis. Tricuspid valve, tricuspid stenosis. So it's just a condition where one or more of the heart valves they become narrowed or restricted. So the blood flow is no longer smooth. So this is forcing the heart to work harder to be able to pump blood because there's a whole lot of resistance everywhere. Of course, there's a complication of heart failure coming up. So for the types of valve issues, you have aortic stenosis, right? So narrowing of the aortic valve, okay. Common causes are there. You can pause to observe the common causes. While mitral valve stenosis, you can see, all right. Then pulmonary stenosis has pulmonary valve, tricuspid stenosis, okay. So all of them you can see the common causes, all right, and you can see the description. That's possible things you observe if they occur, okay. So symptoms is the person is feeling, the person is weak, chest pains or tiredness, shortness of breath, okay. Most of the times, if you ask them to do any small exercise, dizziness or fainting, heart palpitations, then there's edema. So they can be having some 1 or 2 swellings in the leg and also the abdomen, okay. So diagnosis, of course, echocardiogram as imaging, echocardiogram, that's all those electrical activities, the reading and all of that, chest x-rays, cardiac MRI, CT scans, then cardiac catheterizations. All of this will help you to pick up if there's any issues in the valve. So treatment options, medications just to manage the symptoms like diuretics, beta blockers, balloon valvuloplasty. This one, they can actually do a surgery to put a device like a balloon there, okay. It will help to keep the valve, that is the valve area, open. Then valve repair or replacement, then transcatheter valve replacement surgery, okay, can also be done for that.